As we come on the air tonight, a significant number of Arkansans are facing changes to their state insurance. Thank you for joining us tonight at 6. I'm Faith Woodard.
And I'm Rolly Hoyt. The Medicaid unwinding process is done, determining who is still eligible after the end of the COVID emergency. THV11's Jalissa Garza gives us a closer look at the efforts now to get that coverage back for those who say they still need it.
427,000 Arkansans.
That's how many Arkansans no longer have Medicaid after a 6-month unwinding process done by DHS. The number includes adults and kids.
We know that somewhere close to 70% of the people who've been terminated were terminated only because they didn't respond to a letter or answer a telephone call.
Grant Tennille is chair of the Democratic Party of Arkansas and wanted to see DHS do more to reach those people.
When we started Our Kids in the first place, I remember how they signed people up for Our Kids. I have lived through a couple of other Medicaid re-enrollments.
A spokesperson for DHS sent a statement to THV11 reading in part, quote, DHS began messaging to beneficiaries more than a year before the end of the public health emergency. The department adds that they reached out to people in multiple ways and also made staff available through a call center.
Arkansas has, by some estimates, the highest rate of disenrollment of any state in the entire country.
Arkansas State Representative Tippy McCullough says this conversation of Medicaid coverage is one that will continue.
To talk to the folks at DHS, but also talk to the constituents out there and find out why these numbers are so big. They're bigger than they should be.
Representative McCullough says this issue could possibly roll over into the next legislative session.
Medicaid expansion always comes up during our sessions. I think we've got to continue from now until then doing that work, whether it's behind the scenes with our colleagues across the aisle or whether it's with our constituents.
As she works to find a long-term solution, groups like Arkansas Community Organization are working to help people impacted.
We will continue to do so. We will bring those cases to DHS and will continue to advocate.
In Little Rock, Jalissa Garza, THV11 News.
We asked the governor's office about so many Arkansans losing Medicaid coverage. They sent us a statement which reads in part, quote, Arkansas is complying with state and federal law to remove Medicaid recipients who are no longer eligible for the program and will continue to do so responsibly.